Hi and welcome to EpMedic.Firstaid, a channel designed to equip you with theoretical and practical skills in basic life support in first aid. My name is EpMac. This is the video about the principles of first aid, where we are going to give you a skill on how to approach a patient or patients at the scene of accident. Knowing the basic principles of first aid is the first step to being a good first aider. Let us first start by defining what first aid is. First aid is the first help given to a sick or an injured person before being transported to the hospital or being handed over to qualified medical personnel for further medical treatment. As you approach the patient, the three basic principles to be followed are diagnosis, treatment, and transport. The first principle, which is diagnosis, can be divided into three parts: 1. History, 2. Signs, and 3. Symptoms. History is information that we gather as first aiders to know what actually transpired, which has made the person to be found in that particular situation or condition in which he is. So we can obtain this information by asking the patient himself if he is able to explain, or if he is not able to tell us anything, we can ask the eyewitnesses, those who are found at the scene of accident, or we can just observe the environment and see what really happened. For example, if you find someone lying under the tree and there are some branches of trees which have fallen apart, we can simply deduce that this person might have fallen from a tree, and we will know where to start from. Then signs. Signs are unusual physical features that are seen in the body of the patient. For example, swelling, deformity, discoloration, angulation. Then symptoms, these are sensations expressed by the patient himself. He can tell us, he can complain of pain or dizziness and other things which we can not actually see, but felt by him and him alone as a patient. Failure to do a proper diagnosis on the patient will make the first aider do a wrong treatment or never even been able to do anything at all, because you do not know where to start from. As a first aider, you also need to do a thorough investigation to understand the seriousness of an injury before you can actually start touching the patient. The second basic principle is treatment. Treatment as well can be divided into three parts. The first part is to preserve life. Second, to promote recovery. Then the third one is to prevent the condition from worsening. So under the first part, which is to preserve life, this is where we have A, B, C. We simply have to check the airways, breathing, and circulation on the patient. And in the second part, where we have to preserve life, we need to handle the patient with gentleness and reassure the patient. We also need to treat shock if the signs and symptoms of shock are present on the patient. Then the third part, where we need to prevent the condition from worsening, we have to start by stopping bleeding if any, treating wounds if any, and then immobilize the fractures if there are fractures at all. So the patient is most assured when he or she knows that the one attending to him knows what he is doing. And so it is important as a first aider to introduce yourself to the patient as the one who is helping him. The third basic principle is transport to the hospital. The first aider should assess the condition of the patient and recommend the best mode of transport to be used. It could be by hand transport or by the use of the stretcher. Well, if you liked this video, you can subscribe on this channel by pressing on that subscription button, or you can like us by giving us the thumbs up. Then you are going to get more of our videos on basic life support, which is of course first aid. See you in another video.